Hello everyone, my name is Osunsanya, one of the doctors at South Shore Women and Children's Hospital, Victoria Island, Lagos. I'll be talking to you today very briefly about recurrent pregnancy losses. This in turn means recurrent miscarriages. Miscarriages are very common issues that a lot of women deal with. It occurs in about 15 to 20% of all pregnancies. And having 1 to 2 pregnancy losses doesn't necessarily mean you have a fertility problem. However, it's always important to investigate the reasons or the causes of miscarriage. We can actually divide a miscarriage into early miscarriage and late miscarriage. Early miscarriage, which usually happens in the first trimester. Late miscarriages happen in the second trimester. In about 50 to 70% of the cases, you cannot find a reason as to why a woman had a miscarriage. However, if you've had 1 or 2 miscarriages, it's important to investigate the reason as to why you've had them. One major cause is uterine abnormalities. Sometimes we can discover that the woman has either 2 uteruses or there is a septum in between the uterus called the septate uterus. Sometimes there can be some cervical abnormalities. So the cervix is the lower portion or the portion that is just beneath the uterus that opens up and allows for the woman to be able to deliver the baby at term. Another common cause is endocrine pathologies. So the endocrine glands that are most susceptible are the thyroid gland, the pituitary gland. Sometimes you can have disorders such as polycystic ovarian syndrome that can predispose you to recurrent miscarriages. Another common cause is autoimmune disorders. So there is something called antiphospholipid syndrome. There's a syndrome called antiphospholipid syndrome in which the body produces some antibodies that fight against the fetal cells, and this can cause recurrent miscarriages. Sometimes some women have clotting disorders. So there are blood clots that obstruct the blood flow to the fetus, and inevitably the fetus dies, and also there can be a risk of a recurrent miscarriage. So I would like to talk in more depth about one of the major causes of recurrent miscarriages, which is cervical insufficiency. The American College of Gynecologists have described cervical insufficiency as the inability of the uterine cervix to carry a pregnancy to term, usually resulting in the loss of the pregnancy in the second trimester without any form of uterine contraction. It's important to note that cervical insufficiency usually can be caused by previous cervical surgeries, some congenital abnormalities of the cervix, whereby there's a condition called Ehlers-Danlos syndrome, in which there's excessive fibrous tissue that is produced around the cervix, and this can lead to the inability of the cervix to hold through the pregnancy. Also, some exposure to some hormones such as diethylstilbestrol, DES, can also predispose to cervical insufficiency. It is understandable that a lot of women will be anxious, or they will be very traumatized as to the reason why they've not been able to retain a pregnancy, or they've not been able to carry a pregnancy to term. It's important to note that there are various management options that are available for patients that have cervical insufficiency. I will just talk in detail about the management options. So you can have a cervical stitch applied to the cervix. This is known as a cervical cerclage, in which the cervix is tied shut, or a stitch is applied to hold on to the cervix so that you can allow your pregnancy to progress to term. This stitch can be applied via the transvaginal approach, or it can be applied via the transabdominal approach. So for the transvaginal approach, the stitch is applied through the vagina onto the cervix. For the transabdominal approach, the stitch is applied where an incision is made via the abdomen, and a stitch is applied to the cervix through that process. So usually the transvaginal cerclage is applied between the 12th to 14th week of gestation, and closer to the time of delivery, the stitch is taken out and the woman is allowed to deliver. For the transabdominal cerclage, this stitch can be applied via laparotomy. So laparotomy means that you have an open surgery done, or it can be done via a more minimally invasive procedure known as laparoscopy. This is something we do very, very frequently at our facility here in South Shore. So when the incision is made, the stitch is applied at a more higher portion of the cervix. And the advantage to this is that in case of subsequent pregnancies, the stitch is left in situ, so that you don't need to have another procedure to place the stitch. So the stitch can be done before you are pregnant, and it can be done after pregnancy. However, it's important to note that those that are applied after pregnancy can only be done up until 17 weeks of pregnancy. After that, it's almost impossible to do so because the uterus will be bigger, there'll be more blood vessels around the uterus because of the growing fetus, and then there's a higher risk of miscarriage if it's done after 17 weeks. The transabdominal approach is available to patients who have had 1 or 2 failed vaginal cerclages, have conditions that make it almost impossible for us to apply a stitch, meaning that the cervix is too short to apply the stitch, there's absence of the cervix, or there are some abnormalities that will not allow for the stitch to remain in place. So for patients like that, the transabdominal option is a very, very viable option. And it's also important to note that there is the very, very high success rate that comes with application of cerclages. Many studies have been done to show a 98% to about 100% neonatal survival rates. We recently had a study done over a 9-year period here at South Shore as well. And our data, or the data we collated from that study, also shows similar success rates as well. If you're experiencing recurrent miscarriages, there's no need to not seek help. Help is available. You can speak with your managing physician, speak with your consultant, speak with a gynecologist, book an appointment. Let investigations be done to determine. And if there is no cause noted as to the reasons why you're having recurrent miscarriages, these options of a cerclage are available for use. It's sad that in this day and time, we do not have women having the options to be able to be a mother or to be able to carry a pregnancy to term. It's the joy of every woman to be able to do so. So these options are available. So I would advise that you seek help. I mean, if you have any issues, especially with your gynecological or obstetric status, seek help. This help is available for you.
South Shore TV.